In this video, we'll be talking about how to diagnose migraine without aura. Migraine is a primary headache disorder. It's characterized by whether the migraine is associated with an aura, whether it's a definite or probable diagnosis of migraine, or whether the migraine is episodic or chronic. Typically, migraines involve 4 phases, of which not each phase has to be present during a headache attack. The prodromal phase is the phase that occurs before the associated head pain, and it can last a few hours to a few days before the actual headache attack. It involves a series of different symptoms that are individual to the person with migraines and can include hypo or hyperactivity, depression, food cravings, fatigue. Aura is typically a focal neurologic deficit that can last a few minutes to up to 60 minutes typically, but can sometimes last up to a day or several days depending on the aura. Headache is the actual pain associated with the migraine, and postdromal phase is the recovery phase that can involve some of the similar symptoms that are seen during the prodromal phase. To better remember the ICHD-3 diagnostic criteria for migraine without aura, I came up with a mnemonic called PAUSE. P stands for pulsatile, which is a description of the quality of the headache. A is activity, which typically means that motor activity can exacerbate the headache pain or associated symptoms. U stands for unilateral, or a focal area of pain. Severe describes the intensity, which oftentimes will be moderate or severe. E is for extra, which includes associated symptoms of nausea and or vomiting, or photophobia, which is sensitivity to light, or phonophobia, which is sensitivity to sound. To meet criteria for definite migraine, you have to have at least 2 of the first 4 migraine-associated symptoms. And then finally, you have to have at least 1 of these 2 extra associated symptoms. Once this criteria is met, you also have to inquire whether they've had at least 5 migraine attacks with these similar symptoms, whether the migraine has lasted at least 4 hours, and whether there is not another ICHD-3 diagnosis that better accounts for these symptoms. Once you've met all of these conditions, you are diagnosed with migraine without aura. And so what's probable migraine? Probable migraine is essentially someone who has most of these associated symptoms, except for one of the criteria for definite migraine headache. As you also can't have another diagnosis that is similar to the quality of the headache you're describing that might meet criteria for a definite diagnosis. And what I mean by that is if someone meets some of the criteria for migraine but not one, and if you were to compare those symptoms to another primary headache disorder, let's say tension type headache, and they do meet criteria for definite tension type headache, then they can't have probable migraine. You would classify them as having definite tension type headache. And this feeds into a general rule that a definite diagnosis always trumps another probable diagnosis. Lastly, probable migraine should be treated as migraine because it oftentimes responds to the same migraine medications. And so now let's talk a little bit about chronic migraine. To meet criteria for chronic migraine, you have to have at least 15 days out of the month with headache for at least 3 months. And of those 15 days, at least 3 of those days per month have to involve headaches that meet criteria for migraine. The rest of the days, you can have headaches that are more tension type like in nature. And so if you have migraines or headaches that meet criteria for migraine, but they don't occur for as much as 8 days out of the month, and in total you have a lot less than 15 days out of the month with headache, then you'd be classified as having more of an episodic migraine rather than a chronic migraine. So let's talk about a few cases and use our pause mnemonic to decide whether these are migraine. The first case involves a 45-year-old man with a history of hypertension who presented to the ED with a new severe headache. He denies a headache history prior to this headache that started on January 32nd, approximately 4.5 months ago, and has been persisting since then. He presents today because he continues to be refractory to over-the-counter medications he's trialed at home. The headache is severe, unilateral, and pulsatile. Activity does not make it worse, and he denies nausea, vomiting, photophobia, or phonophobia. And so if we were to use our pause mnemonic to try to assess whether he has migraine, it seems that he's describing it as severe, so we can check that off. He's describing it as unilateral, so we can also check that off. And he's describing it as pulsatile, so we can check that off. So if we think about having at least 2 of these 4, he has 3. So he meets that initial criteria. Activity does not make it worse, so he does not meet that criteria. He denies nausea, vomiting, sensitivity to noise, and light. So he does not meet criteria for these last 2. So no, he does not have migraine. So now we have to think, does this example fit into another primary headache disorder? And in fact it does. And even though we haven't described this primary headache disorder, given that he knows the exact date in which his headache started, it's been persistent, and it's lasted more than 3 months, he likely meets criteria for a definite new persistent daily headache. And so for whether he has migraine, because he doesn't meet all the criteria, it's possible we could diagnose him with probable migraine, but he meets criteria for a definite new daily persistent headache. And so we'd probably label him as that and not label him as migraine. So no, he does not have migraine. Second case is a 32-year-old female who reports having a new headache for the past 8 months. Since the onset of the headache, she has had 1 to 2 headaches a week, lasting 6 hours before falling asleep with the headache and waking up headache-free the next morning. The headache is dull in nature, mild in intensity, and predominantly right-sided. Moving around exacerbates the nausea she experiences several hours into the headache. The headache is responsive to acetaminophen or ibuprofen. Is it migraine? So we'll go back and we'll use our pause mnemonic. And just to go over it again, P is for pulsatile, A is for activity exacerbates the pain, U is for unilateral, S is for severe or moderate in intensity, and extra is for extra symptoms including nausea or vomiting, or phonophobia or photophobia. And so thinking about the patient, she's having 1 to 2 headaches a week for 8 months. So she's definitely having more, or has had more than 5 attacks. The attacks last at least 6 hours before she falls asleep with the headache and wakes up headache-free. And just so you guys understand, if you've had a headache for 6 hours and you go to sleep and you wake up the next morning and it's gone, the next morning is what you classify as the end of the headache, not when you fall asleep. So technically we would have classified this headache if she were to have slept 8 hours as lasting 14 hours in duration. The headache is dull in nature, so it's not pulsatile. It's mild in intensity, so it's not severe. It's predominantly right-sided, so it is unilateral. And moving exacerbates the symptoms, so we can check this off for activity. And she does express having nausea, so she has the nausea part of this. Let's see. And so if we were to use this mnemonic, we would see that she does meet criteria for having 2 of these initial 4 symptoms. And she does have nausea, even though she does not have sensitivity to light as sound. So she does meet the initial criteria for migrainous features. She has had more than 5 attacks. They do last more than 4 hours in duration. And from what I can gather, she does not meet criteria for another primary headache disorder. So actually, she does have migraine. And given the frequency of 1 to 2 headaches a week, and having at least on average 4 weeks a month, she would meet criteria for definite episodic migraine. And so this just goes to show that even though someone might come in and say they have a very mild headache that's dull in nature, they can technically still have migraine, given that they meet other criteria or other symptoms associated with migraines. And so going into our last case, a 21-year-old male presents to the ED for a new disabling headache. The headache started gradually this morning and has intensified into a severe pulsatile left frontal headache with sensitivity to light and sound. Is it migraine? We will use our pause mnemonic again to assess whether he has migraine. Let me just write out the extra features of migraine. Alrighty. So the headache started gradually this morning and has intensified into a severe, so he meets criteria for a severe intensity, pulsatile, also meets criteria for it being pulsatile, left frontal, so it's unilateral, and there's no mention of activity, but that doesn't matter because he already meets more than 2 out of the 4 that we need for these initial symptoms. And then for the extra symptoms, we need to know if he has nausea, vomiting, or sensitivity to light and sound. And he does have some sensitivity to light and sound. So he does meet criteria for having at least one of the 2 of these. So initially, it seems like he is meeting criteria for migraine. Now, when we move back to whether he's had greater than 5 attacks, it looks like this is his first migraine, if this is in fact migraine. So he doesn't meet that criteria of having at least 5 attacks. And it seems like the headache started this morning, but we don't actually have a duration, which is important to clarify when someone presents for evaluation. But let's say he were to have 4 hours. He would, because he doesn't meet this criteria of having had at least 5 attacks in the past, he doesn't meet criteria for definite migraine, because there's one criteria out of all of them that he's missing. So actually, he has more of a probable migraine, not a definite migraine. So we're not sure if he'll go on to develop a primary headache disorder at this point. So I hope that these 3 cases and the pause mnemonic has helped in terms of assessing whether someone has migraine without aura, especially because migraine is one of the most underdiagnosed conditions in neurology, of which it is also one of the most disabling conditions in people younger than 50 years old in the US. So I hope this video is helpful in terms of assessing patients in the future. Most of this information I adapted from the IHS classification ICHD-3 diagnostic criteria for migraine without aura, and that is the diagnosis of migraine without aura.